Welcome everyone to today's webinar. I'm Morgan Hafner, writer and reporter with Becker's Hospital Review. We will begin today's webinar with a presentation and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. We are looking forward to hearing your questions. Additionally, in about a week following the webinar, we will be sending you a copy of the presentation to the email you used to register. Also, we want to encourage everyone to join the conversation on Twitter using hashtag JiveCase and also tag Jive on Twitter. Their Twitter handle is @JiveSoftware. At this time, it is now my pleasure to start today's webinar by introducing our presenters. Amy Castillo, Senior Learning Consultant at Trinity Health. She is a learning and community strategist with over 20 years of experience in assessing, developing, and delivering innovative, effective learning and community solutions. At Trinity Health, Amy has helped lead the organization's efforts to leverage Jive for social learning. Recently, they have increased the Jive user base by nearly 30% in support of learning and collaboration communities for the clinical organization. She is passionate about creating strategy, designing, and teaching others to create social learning communities of practice. And we also have Bill Kelso, Director of Healthcare at Jive Software. Bill Kelso is the Director of Sales for Healthcare at Jive Software and has 25 years of experience in the technology and healthcare industries. Bill holds leadership positions, holding leadership positions at Bond Company, Cerner Corporation, and Spectrum Health. Over his career, he has managed technology implementation projects at several large industrial and healthcare organizations, both in the U.S. and abroad. For the past 5 years, Bill has been deeply involved in social business, having completed 2 successful Jive implementations at Cerner and Spectrum Health. Bill is a father of 4 and enjoys outdoor activities, including skiing, mountain biking, and hiking. He has a bachelor's degree from Ferris State University and a master's from Western Michigan University. Bill, I'll now turn the floor over to you.
Hello, everybody, and welcome to today's webinar. As you can see from the quote above, fragmentation in healthcare is a real issue, and it's creating real barriers to care coordination. This fragmentation is evident both in the delivery model, but also inside of our organizations. So let's take a quick look at some of those areas where we're seeing fragmentation inside our health systems. First of all, our data is siloed and it's kind of all over the place. Many of the health systems have multiple EHRs, and even if the system is on a single standardized EHR or a single vendor, many of the patients are still accessing care across multiple venues and multiple health systems, leaving their data kind of sprinkled all over the place in many different databases. Another area is the way in which we approach communication. Our communication processes are quite fragmented. In many cases, we still are reliant on things like email blasts, physical flyers, and newsletters. All of these are one-way, point-to-point communications, which do not allow any feedback and are not measurable. Most clinicians feel inundated with all this communication. Most of it's not targeted to the role, and as the result, they kind of just tune out the noise, making it increasingly difficult to get the important communication out to the people that need it. Our communication tools are also fragmented as well. Each system that we use creates yet another data silo. The latest trend is secure messaging. And unfortunately, while this does in some cases speed communication between clinicians, it also creates yet another data silo. And in many cases, these systems are only partially rolled out and aren't available to all the caregivers. So again, communication breaks down and we have to rely back on other forms of things like email and paging and things like that. Finally, another challenge that we run into is that in most health systems, only about a third of the staff are actually, or a third of the physicians are actually employed by the health systems. The other 2/3 are people that are in, different group practices and things like that. So how do you create a place where you can coordinate and collaborate with both your employed staff and your non-staff, and where they can work together, and that the notifications and information is actually flowing out to them through their preferred email address and their preferred devices, so that it's actually reaching them. These are all challenges that we run into, and each one of these creates challenges around fragmentation within the health system. So next, it's my pleasure to introduce Amy Castillo from Trinity Health. And Amy's going to talk about how Trinity is using Jive to create this connected, basically a way to connect clinicians across the care continuum. Take it away, Amy.
Right. Thank you so much, Bill. And I'd like to start by thanking the team at Jive and at Becker for the opportunity to come and speak with you today. I'm Amy Castillo, and my colleague Al Redding, who's not with us today, is part of this solution. We're both part of our talent development organization at Trinity Health. And so we're going to bring to you a little bit of information about what we're doing. So we'll start by talking about who Trinity Health is. So it is one of the largest healthcare organizations that is in Catholic healthcare in the nation. We have 22 states, and in those 22 states, just one second here, we have 93 hospitals. We have 120 continuing care facilities, PACE facilities, Mission Health and National Health Ministries, home care and hospice. You can see we have 47. We provide nearly 2.5 million home health and hospice visits a year. We employ over 97,000 employees, as well as about 5,000 employed physicians and almost 24,000 affiliated or non-employed physicians. So we are quite a large and diverse system. And so our challenges around communication and collaboration are significant, as you might imagine. So today I'm going to share with you 2 use cases. And the first one is, as I said, I support learning and development, and I support it entirely in the clinical space. So we work a lot with our clinical leaders on strategic initiatives across the system. So we have 2 use cases. One is around using Jive to connect communities of practice across the system in specific clinical areas. And the second is around how we use Jive for virtual summits to kind of turn the live event on its head, as it were, to do something a little bit different. So let's go ahead and jump first into our poll. We want to ask you a question first before we get started. So what's your biggest communication challenge with your clinicians across the healthcare system? Does it relate to geography? Do you have locations spread out among many states? Do you have different time zones and shifts? Do you have frequency? Maybe people only come together once a month on conference calls. Or do you have problems with engagement, your clinicians not being engaged in the conversation? Let's go ahead and take a look at that poll. Give everybody a few seconds to take the poll. Just waiting for a few more of you to get your votes in. Let's go ahead and wrap up that poll. And hopefully you're going to be able to see the results here in a second. What I'm seeing, and we'll wait for it to show up for you if you don't already see it, is that 72% of you said engagement is an issue, and we have that same issue as well at Trinity Health, and really trying to get our clinicians engaged in the conversation. And it's also related to how much we get together. So about 12% of you said frequency, you don't get together very often, and 11% geography, you have some of those same issues. A little bit smaller on the time, but engagement is definitely an issue, and you will see that we have that issue as well. And so what we've done using Jive really helped us quite a bit with getting our clinicians much more engaged in the conversation. So let's go ahead and move forward. And I'm going to talk about our first use case. So our first use case is our connecting communities, and it really talks about bringing Jive in to bring our end users, our clinicians and physicians together in a collaborative environment. And the biggest challenge for us was bringing our employed and our affiliated folks together. And so at Trinity Health, when we look at how do we connect clinicians, we connect them across the care continuum. So we start at the doctor's office. It goes through to acute care hospitals, to our ambulatory care facilities, to our home care, through our rehab, our senior living, all the way to our affiliated care partners in the home or in hospice. Historically, we really were challenged with finding a way for our internal and external clinical colleagues to reach out to each other, to come together and share best practices. We didn't have an easy way for them to do that. And we don't consider Outlook an easy or effective way to connect them. So it just gets inundating for most of our colleagues and physicians. So we really had that challenge. The next piece of the challenge was who our providers were. So as we shared, we have 5,300 employed providers, but nearly 24,000 affiliated or non-employed. And the reality is they're locked out. They're kind of shaded out of the system in terms of getting the same access that colleagues get. So our affiliated providers don't always have an easy way to access our intranet, our shared drives, or even things like our document management system. So that would continue to be a challenge for us. Next challenge was, as you can see, we have a lot of one-way communication. We have over 1,000 sites of care, and we really struggle with bridging the physical and virtual barriers and sharing those best practices at evidence base. And so currently, outside of our meetings or one-to-one contact, people don't really do anything other than one-to-one email and attachments. And just like you might imagine, as I said it earlier, the amount of email is oppressive for our folks. We have clinicians that don't even want to check their Trinity Health email address because there's so much in it. And so we had to find a different way. We had to find a better way. So our opportunity, in our previous model, it's kind of the hub and spoke. There was one person in the center kind of sharing out the information, and it's not effective. Our leadership, especially in the clinical space, wanted us to find a way to encourage standardization, knowledge sharing, get our practitioners to access each other peer-to-peer outside of their specialties or groups, and not this kind of hub and spoke model. So we needed to open the collaboration and flatten the barriers that were really keeping people in their silos. And so what we did was we changed the model. We created Jive communities to help start to break down those silos and start connecting people to each other, bridge the time, the distance, and open up the collaboration and learning. And it's really done in a flattened, everybody has access to everything all the same way, the same time, across all of our health systems. So let's look at the Jive solution that we started with. We started out with this idea of a collaboration hub, and it was a place for cross-functional system-wide collaboration. So we wanted to use Jive as a way to share content and information, standardize that content, for people to collaborate when it was convenient for them, right? Because we have physicians and clinicians on all different shifts. And also to problem solve and share their best practices. So the result is this community right here. And this is a look at kind of the home community of our integrated care coordination initiative, really at our system level. And this is work that's trying to bring together people across the continuum of care, as we talked about earlier, to come together and work and share. And so this is the integrated care coordination homepage. But what the Jive solution really did, as you can see in that kind of back end graphic there, that we actually had 9 separate communities. The first one was that homepage you just saw, and then we had 8 communities that are represented here in the puzzle piece graphic. So a couple of the things that we did, we created this as one homepage to connect those clinicians in their specialty, but also to help them get connected to things that might be related to the work they're doing across the care continuum, such as population behavioral health, BPCI, I'm sure that's not an unfamiliar term with many of you, community health and well-being. We're having a lot of fun in alternative payment models. All of these things are related to the work across the integrated care continuum. And so these 9 communities were actually all externally accessible. So we made it so that folks that did not authenticate into the system through a Trinity Health email sponsored address could still get into it. They're all private. It was invite only, and so it's all very well organized around this integrated care coordination model. We also use this image map, we call it, and it's a clickable puzzle image map. It sits on each one of the 8 communities and the homepage as a place for them to connect. So our users can go back and forth between the communities and stay connected to the entire continuum. What this allowed people to do, it allowed them to connect and engage with peers in other related areas without having to leave their Jive space. It also allowed our external and affiliated physicians to come together and connect with other clinicians and share those best practices and evidence, which is a critical piece of our success in being able to get those folks connecting. We regularly hear from our affiliated physicians how happy they are to be a part of these communities. And it really allowed initiatives, leaders across our system to, get folks to get information about other areas. So for example, our community health workers who have a community health and well-being community can also look into the bundled payments community and learn about what's happening there. So it was a really great solution to bring them together, to see all of these pieces of the care continuum together and to start to learn and collaborate together. One of the communities we really like to share is one of our best practices, and it's our community-based palliative care group. And this is a look at their page, their community. And what was happening for them was they had lots of change happening in how we provide community-based palliative care. We have new provider roles. We have a new model with traditionally local organic growth. And we had a leader, and this leader is the person you see there. Her name's Lori Yosik. We love her. She's a type of community leader that we all love, because what she did was change the way people worked in her area. So instead of using the email and the typical phone calls only once a month, she said, I'm going to do this differently. So she started by making a conscious decision. She was going to change the behavior of her team. So she stopped email distributions. She said, I'm no longer going to send you documents in email. She only posted things on Jive. When people came to her and asked questions that the community could answer, she redirected them to Jive. So instead of her being the hub and all the spokes coming to her, she redirected it back to the community. And then as people participated, she publicly recognized them, which is a huge piece of it. And so one of the things that she did as well is she still kept kind of monthly office hours calls, which was great. But instead of using that for these general questions people asked, she would push the general questions to the community and then use the in-person conversation or the call to really be that problem solving that they really needed to talk through. So one of the lessons learned by Lori and many of our other leaders in this process is that they have to be engaged, and we're very lucky to have a very engaged leader owning this community and driving it. But you can't also expect 100% adoption. She's still working through getting people in, but we've seen a lot of success in this community and the other 8 as well. So that is the first use case that I wanted to share with you. And we'll move on now to the second use case, which is about our virtual summits. So again, we're using Jive in a lot of different ways. That one was kind of focused on getting people to share and collaborate with each other. The virtual summit model really started as a request to get people to learn differently. So we started using Jive to build the backbone for our virtual summit. So what was the challenge we were dealing with? So first thing was our business challenge around this. Typically, we had our clinical teams come together for annual events, 2 to 3 day long live events, and they had learning and networking, knowledge sharing. But our C-suite came to us and said, we've got to limit this. We've got to look at our budgets, and this is something we're going to have to modify. And so they came back and said, these are going to be no budget, or it's going to be limited budget. But our colleagues said, but we still want to bring the industry leaders in. We still want to hear from each other. We still want to network, get to know each other, build relationships. That was all part of what was the most beneficial about these in-person summits. But they also only allowed a very limited group of colleagues to participate. So they came to us and said, well, what can we do differently? And we said, well, we've got a solution that will change the way that you do these summits. So we used Jive as our backbone, as I said, and created an immersive, continuous learning and knowledge sharing event using Jive. We brought our clinical leaders and industry leaders outside of our organization together to learn and network and collaborate. We actually have had multiple clinical summits using Jive with a combination of WebEx and Poll Everywhere as well to bring these together. We integrated CME credits into the programs for both the live event and the recorded sessions, which made our physicians very happy. And at the end of all of it, we created a virtual conference playbook to help facilitate our processes in building our communities and planning these for future events. So what does the model look like? So the virtual summit model was created to provide a live, synchronous, virtual learning experience that is supported by Jive social learning communities. That's the backbone. They included a few things. We had pre-event, synchronous, so during the event, and post-event communication, collaboration, and content sharing all happening in Jive. We had enrollment, the materials, the distribution through Jive, and the ability for folks to connect ahead of the session. We did things like asking pre-event discussion questions to get them ready for the events. During the events, we did synchronous, interactive tabletop exercises where our local teams got together and discussed a problem or a question in small groups and then did their debrief and their report back within Jive. So it was all kept in the environment. We used interactive polling to gather direct and dynamic audience feedback during the learning sessions as well. And then last, we used WebEx to capture them and then package that presentation for future use. So that was what our model looked like. It had all of those elements. The first example was our CLD solution, and we like to call it our continuous classroom. So the CLD was an initial 2-day clinical leadership development virtual learning summit. So that was the kickoff. We did this last year, and we followed it by monthly learning sessions. In our first kickoff, we had over 400 clinical leaders, I think about 430 across Trinity Health, and our first what was called the boot camp. And monthly, we average about 100 to 150 participants. So we've got folks that are attending live, and we've also got folks that are reviewing the recorded CME events as well. But it was really the first time we used this continuous classroom environment to support a live virtual event. So some of the elements that helped us to be successful for this virtual event, we had local and system chat masters so that there was a continuous flow of conversation. And we did that in WebEx. We used Poll Everywhere for instant input and feedback. So if we needed a yes, no question answered right away. And then the Jive discussions for tabletop exercises were a really key piece for us in helping people keep engaged no matter where they were connecting from. Every person might not have been on the WebEx meeting, but every single person was connected through the Jive community. So that was a really important piece of it. And in the Jive learning community, we had the pre-event discussion starters. So if the topic was leadership development, we had thought starters to get them thinking and talking before they even came to the event. We did all the distribution through the Jive community. So even though we had lots of people asking them to be emailed, we kept it all there. And so we drove people to start coming to the community that way. The tabletop exercise questions and answers was very rich conversation, lots of people giving feedback on each other, sharing best practices and stories from each hospital. And then having the presentations posted both before the conference and then the recordings posted after for participants that might not have been able to make it. Those were the key elements for us and how we built this first continuous classroom environment. The benefits. So we've done 5 of these so far. We're planning our 6th and 7th right now, but we were actually able to reduce our expenses significantly. So over about 5 summits, we've saved about $250,000 in cost avoidance so far. We also provided national access to a significantly larger audience for learning and collaboration. So we were able to increase the people that could actually participate by about 150%, more than 3 times what we could do when we had an in-person. So that in itself is a huge benefit because we're getting the knowledge and the sharing and the participation and the engagement out to a much broader audience using this model. We reduced time and expenses for presenters and clinicians to join the virtual sessions. So sometimes our folks couldn't come. They couldn't get away for 2 to 3 days. So now they can come and join and get right back into the practice of their work. We used our Poll Everywhere and our Jive discussions to keep that engagement going through the event and before and after. And then you, again, drove people back to the Jive community for their CME, for their videos and information such as that after the event. So the continuous classroom is really, what we're calling it because it's not just during that virtual event. It's before, during, after, and all around. So this is a picture of the clinical leadership development community, and this is, from our February site. We're doing them every other month now. We're not doing them every month, but you can see we've got, our events. We've got the content from the past year. We've got our tabletop discussions, and there's a lot more happening on this, as well as videos. All of our CME recordings are there. So this is the community where they come to practice and get kind of what they need in the learning. And it's an externally accessible for our, again, affiliated providers who are a huge part of this community. Let me go to the next slide. One last example that I wanted to share with you is our PPSI OB Summit. So this is for our perinatal patient safety initiative. And as you can see in the picture below, our perinatal patient safety teams, they have about 22 work streams actually across our entire hospitals, all of our hospitals. We deliver almost 2% of the babies in the US. And so our practitioners are very active across the entire continuum of care for those babies and mothers. We had typically, when they've done in-person events, they have about 80 people that were able to attend. And they've gotten very used to using that in-person event as their place to come together and share and collaborate and get to know each other. In the last couple of years, we have merged with another huge system, and so about half of our hospitals were new in the last couple of years. So having their in-person summit was a huge differentiator for them to come together and really learn, but they were only able to help and have about 80 people come together and learn together. So when we came to them and said, we could do what we did with clinical leadership development for OB Summit, they were a bit skeptical at first, and they weren't quite sure that we were going to be able to pull it off. And this ended up being one of our more successful summits. We were able to increase the number of people who came from about 80 to about 350 from across the continuum of care. They came to a one-day virtual summit. We had national experts, industry leaders present, as well as internal folks on a lot of different best practices, clinical evidence practice, patient experience of care for babies, and things about using nitrous oxide, and all kinds of really top of mind pieces of the perinatal patient safety work. We also had things like virtual posters and recognition videos that we did so people got to know each other, even though they were in a different environment. And again, we used CME and questions both before, during, and after for this session. And so again, another example of how we were able to take this in-person summit and turn it into a very enriching virtual experience. So here's an image of that screen of the perinatal patient safety community. And again, you can see we've got an introduction from our Dr. Jerry Girardi, who is our medical director for perinatal patient safety. We're, asking questions. We had lots of questions throughout the entire presentation as we went through it. People got in and asked and answered. We've got the content from the presentations here. And then after, we've got all these CME enduring materials for folks that may have not been able to access it or wanted to look at it again or share it with their colleagues. So another great model that we have done that has changed the way that people learn in our organization. And we are now currently planning for PPSI Summit 2017. So it went so well that we're going to keep going this way. The last thing I want to share with you is where we went from the beginning of this to kind of where we are now. So there was a huge interest across our clinical space for how do we do this differently. And so we actually put together a playbook that put the structure in place for how we pulled this off. So as you might imagine, Jive is a huge piece of how we did it, but it involved a lot of other things too. Changing, getting your speakers ready to present in a different way than they're used to, building that community of practice, building the engagement for that community of practice. We had elements there, getting people into the sessions ready and getting CME, polling, and then at the end of all of it, working through the video editing and publishing processes to get it to the next step. So that was kind of what we have built and have been sharing across our system as we continue to kind of get more requests to do these types of learning events in a different way. So the last couple slides I want to talk to you about here are what did Jive help us to do that maybe we weren't able to do before, and then what were some of our lessons learned. So one of the differentiators for us with Jive is it gives us a way to connect with our clinicians without impacting their day in a huge way. So they can still connect and collaborate without having to go away for a one-day conference or be away for hours and hours on end or a couple of days. So it gives them a way to reduce the time away from their patients and teams, but still stay connected. It also helped us to standardize our content and our processes across the system for some key populations. So especially for the community of practice I shared earlier, it gave people a single source of truth. And it gave them a place to all collaborate on the same documents without the version control issues and access issues that they'd experienced otherwise. We were able to significantly reduce the email volume for many of our teams, especially attachments. We're well known for attaching things to everything. And it also allowed us to leverage the content consistently and gave our clinicians a way to share that evidence-based practice in an instant, not having to wait through it to go through a long vetting process. They could share with each other all the time. It allowed us to create multiple channels of communication and connection between the peers across the system. And I would say that this is one of the things that gives me the most joy when I watch people communicate in the system. You know, being at a system level office, you typically feel like you are the bottleneck in the middle. And Jive allows people to connect with each other without us getting in the way sometimes. Sometimes we get in the way. And they don't need us with something like Jive. We don't need to be the hub. We don't need to be this part of that model. And it's a much better situation for our colleagues when they are connecting with each other instantly to share learning and best practices. Jive Mobile was a huge differentiator for us because of the fact that it is accessible anywhere. We didn't, you know, people don't have to be locked down to a computer. Many of our clinicians are not sitting in front of desks all day. So this really helps them to stay connected. And Jive for us really helped us inspire this model of how we could learn and come together differently to, you know, by using the social learning communities and have that continuous classroom environment, allowed us to do things in a completely different way. And without Jive, I don't think we would have been able to do that. So the lessons learned for us, and there are many, these are just a couple of them. One of the things we have learned, you know, it's a new process, and so with all new processes come challenges in learning. But the first thing was that this type of social collaboration was new to many in our culture, especially our senior clinicians. So one of the things that we have to do is really help people view the possibilities and see it. So that kind of gets into the third bullet there. Some of our business owners get it intuitively, and others need to be brought along to see the possibilities. So if you have clinicians that aren't social in their everyday life, it is hard sometimes to see what's possible in looking at a tool like Jive and how you connect people differently. And so I always recommend that you show them what's possible when they might not be able to see it otherwise. From a learning perspective, this doesn't really fit people's common preconceptions about what learning is. And so again, we're breaking the mold in terms of learning isn't just a classroom. Learning is coming together and learning from each other, asking each other questions and answering them. It's not just about the didactic experience. And then the last thing I would say is that, you know, again, helping leaders recognize the value of this approach, especially the virtual summit model, and kind of letting go of that traditional in-person or virtual didactic model has been very hard. They're used to some, you know, we call it the sage on the stage. Somebody gets up and imparts their expertise, and maybe a couple people ask questions, and then we're done. That's not the model that we're using now, and it was a paradigm shift for us to go to that virtual collaboration and learning. And we're still on that journey on educating our folks to do that. So that is the end of my presentation today. I thank you for your time and attention. And loving to hear the questions that folks might have as we finish this up. I'll stop right there.
Thank you, Bill and Amy, for that fantastic presentation. Before we move on to the Q&A, I want to let our audience know that there is an upcoming opportunity to engage with Jive in person. Jive will be at our annual meeting April 17th through the 19th in Chicago. They will be in the exhibit hall at booth 29 if you'd like to stop by and discuss more. We will now move on to today's question and answer session. Please submit any questions you have by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. We will try to get through as many questions as we have time for. And it looks there's a lot of questions coming in, and the first question from the audience is, what are the keys to sustainability of this platform? How do you make sure things don't get stale and that it continues to be useful?
All right, so I guess I'll take a first attempt at that one, and Bill can chime in. So I think what I would say is, over the time that we've been doing these, it's really active and engaged sponsors. I think you've got to have leaders who get it, who are willing to be a part of that community and really push the envelope in terms of getting people to look at it differently. And the content can't get stale. It's one of the things that we share with our clinicians is that it is a living, breathing community. It's not a place to get stuff. So it should always be an active conversation. Bill, would you add anything in terms of best practice?
Yeah, I was just going to say, from Amy's absolutely right. There's the community management aspects of it and managing the content that way. And then within the platform itself, we do a lot on the technical side to help make that happen as well. So our search is always looking at the age of the content and moving the old stuff to the bottom so you don't run into old content. We have ways to flag content as out of date and promote the new content. There's analytics behind everything, so you can see, content that's going out of date. So there's a lot of technical aspects that help manage that and keep the content fresh and keep the fresh content to the front. And then there's also the things that Amy mentioned around just the community management and people, kind of managing the content. We do versioning across the whole, automatic versioning across the whole system. So one point that Amy made is that the big difference in this kind of platform is that it's really a place where people are doing work. And so it's a lot of living, breathing content as opposed to a bunch of static documents. And that really fundamentally shifts the usage and the way people look at it.
Thank you, Bill and Amy. Those are really good points, especially about how it's an active conversation. An audience member is wondering, what could be the potential impacts of physician ownership as compared to physician employment on the healthcare system in general? And if, Amy, you want to take that question.
I'm going to let Bill go first.
Yeah.
So I think if I understand the question correctly, one of the challenges, and Amy kind of alluded to this, is they have 5,300 employed physicians and then 23,000 non-staff physicians who practice at their health system. And one of the challenges that we see kind of over and over again is that the staff physicians are accessing their internet, they're accessing all their tools and things like that. The non-staff tend to be kind of left out, and it's a challenge to bring them together to collaborate together, even though they're both critical to the care. And so one of the things that we do that's kind of unique is we allow you to create kind of these areas where you can bring both groups together in one place, and the physicians come in securely into the system and provide their preferred mechanism of communication. So there will be their practice email and their mobile device. What that does is that allows us to, bring all the notifications to a place where they're actually looking. So our goal is really to create that community regardless, basically a secure community regardless of your, whether you're employed or you're just affiliated, but you need access to these certain areas because you're working on a committee, you're working on a program or whatever with the health system. Hopefully that helps.
Yeah, and I would add a couple of comments to that, Bill. Thanks for taking that one first. In that, you know, in both of all of the communities that I shared with you today, they're all externally accessible, very much for that exact reason, because our affiliated partners we don't view as separate from us. They are part of us. We all have to work together across the continuum of care for this to be successful. And so they've got to be a part of that conversation. And we have a few of them who are very active members of our community, you know, folks that work in our clinically integrated networks and folks that are affiliated that really are thankful to be a part of the communities that we have and actually participate quite a bit. And so that in itself brings the engagement up for those folks so they feel like they're part of the system a lot more. So when you get into physician ownership, no, that's exactly what you were looking for, but really there is an engagement from our affiliated physicians because we have a way for them to come together with us to have that conversation.
Exactly. Thanks for that great question and really informative answer from both Bill and Amy. Another audience member is wondering, how has the Jive approach optimized physicians and clinicians' relationships with both patients and payers, and if there is more than one patient condition involved?
So can you just rephrase that question or reread that question one more time here?
Of course, yeah, I'd be happy to. They asked, how has the Jive approach optimized physicians and clinicians' relationships with both patients and payers? So that was the first part, and the second is, if there is more than one patient condition involved, multiple specialties needed, how would that be addressed?
So the first community that we showed was the interaction across the continuum of care, right? So we're working in traditionally, and this is no different than any other healthcare organization, people work in silos. And so bringing those communities together, those 9 supporting areas across the continuum of care together, is starting to break down some of that information hoarding, as it were, between those different areas of the continuum of care, so that when we're talking about a primary care patient who is struggling with diabetes and needs a knee replacement, how are we working together? So just the fact of bringing them together to find that information together and start to connect a network together has started to break down some of those barriers for those clinicians to start interacting around the whole patient experience and not just the specific area. So I don't know if that gets to the direct, but I would tell you just anecdotally, and what we hear from our physicians and clinicians that are part of these communities, that there is a lot more collaboration between our physicians and clinicians across the system. You know, I think we always had it in our local ministries. Our physicians and clinicians work very well together, pair, do dyad, leadership models, all of that's already happening. But now we're able to replicate that experience at a system level so that the chief nursing officer in Loyola is able to talk to the chief medical officer in, you know, St. Alphonsus and Boise. So we're able to extend those relationships across rather than just within.
Yeah, and I would just add to that. And, you know, one of the things, again, that's kind of unique about Jive is we can do both kind of the internal community, which is really where, you know, Trinity's using it primarily, connecting the clinicians on the internal side, and then externally as well, all in a HIPAA compliant way. So we have several insurers we're working with where they're running wellness communities for their members. We're starting to work with a couple of hospice organizations that are basically building a external community to support the patient, where you're bringing the family and the patient and the caregivers all in together. So, you know, I think it's one of the unique things is, depending on what your use case is and what problem you're trying to solve, we can kind of blend those two worlds in a safe, you know, HIPAA compliant way.
Great, thank you so much for clarifying that. We have an audience member who would like to know, have you leveraged Jive to improve communication among data collection for community shareholders who are engaged in population health management?
We have not yet, but that is giving me some great thoughts to take back to our teams in population healthcare management. The possibilities are pretty endless. You know, one of the things we've been investigating, and I'm sure Bill could speak more about it, is how we can integrate some of our dashboards, our clinical dashboards, into Jive. And so from a data perspective, taking Tableau and bringing that in, or integrating other APIs, is something you can do. So I don't know if that starts to get to it, but we're looking at it.
Great, thank you for answering that, Amy. And another audience member has a question for Amy. They ask if you could talk more about how Trinity used WebEx and Jive together, and how the Trinity was able to keep the focus and conversation in Jive and not on WebEx.
Well, that was really easy for these particular sessions. I would say a couple of different things. So first of all, WebEx is our platform for virtual meetings, right? So it's what people are used to when they come together virtually. But we integrated Jive in such a way that the conversation started well before people even came to the live event. And so we started them there. We got them ready for it. Pre-event in many of our summits, we were a month ahead of time getting people in there, asking questions, getting them to answer them, getting them used to being in the environment of Jive, rather than using WebEx solely for their questions. So that was part of it. We also, during the event, just ask people to use Jive as the way to connect. The only thing that we asked them to use the WebEx chat for was technical issues. In addition, a lot of our folks were joining the sessions in large groups. So we might have our physicians and our nursing leaders would bring in physicians and nurses into a large conference room. They would use the WebEx as the presentation layer, but the interactive layer was really happening in Jive. And so they were connecting individually in Jive rather than as a whole group in WebEx. We also, not necessarily for this use case, but we do have WebEx integrated with our Jive instance, so they can actually work very well together in terms of, if you have a community, you can set up a meeting directly from that community straight with your WebEx connector. There's a lot of integration points, but ideally the way that we've used them is Jive is the place for the conversation, WebEx is the place for the viewing of the presentation and the capturing for us to be able to use that video content later. I don't know if that answers your question, but hopefully it does.
Great, thank you. Oh, sorry, Bill.
I was just going to stress that, yeah, Jive has, part of our, platform design basically is to kind of create this digital hub. So we, Cisco is both a customer and a partner. So we have integrations with both WebEx and Jabber. We have integrations with the full Microsoft stack, with Google Docs, with, kind of all your major, kind of different types of products that you would use in a productivity space. We built kind of standard integrations with. So the goal is really to make it easy for the user, so that when the user comes in, they get a kind of a single unified user interface that's easy to use. And especially when you're dealing with clinicians who are very busy, that ease of use becomes really important.
Yeah, it's a huge differentiator. Yep, they love how easy it is to use.
Great, thank you both so much for pointing that out. And Bill, this question is for you. What could be the potential impacts of physician ownership as compared to physician employment on the healthcare system in general?
I thought we already had that question.
Did we already?
Because I'm not sure.
It looks like that question may have been answered. We can move on to a different one. We have a ton of really great questions coming in. So, one audience member is wondering, what other opportunities do you envision for Jive to add value for learning, collaboration, and community building in hospital environments and the healthcare industry at large?
I'm getting there. Sorry, folks, I muted my call. Yep, I muted for a moment. So large question. It's a very large question. So at Trinity, we are exploring the use of Jive for quite a few different things from a learning perspective. We actually built last year a graduate medical education university, GME University, using the platform, and that was to really have our faculty and residents come together to learn, and we really put the learning in the hands of the faculty members for residency programs. So that's already something we've done, and we're moving into using it a little bit more for tracking informal learning. We're integrating with one of Jive's partners, Smarter Path, to do some more kind of like distance education type learning within Jive that's tracked there, and starting to explore that with some of our clinical leads. So we are not stopping using it for learning. It's actually been a very powerful informal learning system for us to use to really teach people to learn in a different way. So for us, we can't stop seeing the possibilities. I would also say that from a clinical only, that our clinical teams that do the work across the system for things like sepsis and experience of care and all of those types of things use Jive as well to connect their community members, just like you saw with the community health, the palliative care group that we showed you. They're using it over and over and over again to bring their communities together online as well to collaborate. So that's what I'm seeing. Bill, what do you have to add?
Yeah, I think those are all, really common kind of use cases. I think to Amy's point, there's really anywhere you need to bring a group of people together to communicate and collaborate, Jive can really help there. I think we have several health systems where Jive has become their full intranet, so they're kind of replaced whatever else they were using with that. We have quite a few using it around collaboration around their EHR, and typically with either rollout or optimization efforts. Things like they're trying to validate order sets and things like that. They basically do that process through Jive, whereas they used to do it through meetings and email and things like that, and are saving a ton of time by being able to do it in a more collaborative way. Another real common one, it's very simple, is just the idea of a self-service help desk on the IT side. So front end your help desk with a self-service option. That's really where Jive started 15 years ago, was in the technology support area. So companies like Google, Apple, Oracle, they all run Jive to help with that support process. So it's really, you could take that same technology basically and bring it in your environment and just make that process more efficient and easier for your clinical staff.
Great, thank you for that great question, really, and informative response from both of you. And an audience member wants to know more about how Jive works with medical device companies, and the question is, how can medical device companies engage better with customers using Jive?
I'm not sure I have, I don't know if we have any examples where Jive is necessarily directly integrated with a medical device. But it's that device manufacturing process. I think both from getting feedback back from their customers, supporting their customers. We have quite a few customers that use Jive as a customer community, so getting external feedback back from their customers, as a support community, so getting the information out, troubleshooting, things like that, medical devices, and then of course internally within the organization. So I guess that's off the top of my head.
Yeah, thank you for clarifying that. And the next question is, an audience member says that they understand that this is an intranet, internal to one organization, function. Would this format work for extranet communication with outside agencies as well?
Yeah, so we probably about, I think it's somewhere around 40% of our business is actually externally facing communities. And those, again, can be anything from, technology communities. We have several learning institutions that use it that way. We're starting to work, like I said, with a couple of hospice organizations. National Institute of Health uses it for research, so bringing together, research initiatives that they're doing with multiple health systems and education facilities, so they can basically bring everybody together in one place. So yeah, it certainly could be done both internally and externally. So
great, thank you for that. That's a really great point. And the next question an audience member has is, how do you get business owners to buy into a new model?
Well,
Amy?
so yeah, I would say persistence pays off, or that's what my chief medical officer said to me after a couple of years of me telling him that Jive could do what he wanted to do better. So that starts, persistence is always good. But I think it is, as I said in the lessons learned, it's about seeing the possibilities. So many of our business owners, this is a new way for them to think about working, collaborating, sharing, learning, all of those things. And so, you know, our best way to do that is to let them see it, give them proof of concept, share best practices, share what other organizations are doing. You know, coming back from you know, conferences where this is discussed, some of you should check out Jive World happening in May. People get really excited about what's possible, and you can show, you know, your high-level leaders at your organization what other organizations are doing. And that gets them excited too, to say, oh, well, you know, Cleveland Clinic's doing this, or Trinity's doing this. We want to, you know, we want to see what other folks are doing. So at the end of the day, the number one thing that gets business owners engaged is seeing the value that it provides to both them and to the clinicians that they support out in the field. And sometimes that value can be just as easy as a question getting answered, or finding the best practice on something, or finding a clinician who's an expert in something you didn't know about. And so the number one way to get them engaged is to find something that is valuable to them and show them how to do it in Jive. So there's my answer on that.
Yeah. And I'll just add, and just by way of background, I came to Jive through two different customers. I was 8 years with Cerner Corporation, and then 4.5 years with Spectrum Health, West Michigan Health Network, before I joined Jive 3 years ago. So I implemented at both places. So I kind of went through that challenge as well. And I think it's this combination of some, you know, top-down leadership, encouragement, and bottoms-up growth. And where it really shifts is if you get people to move their work there. And that work could be around a committee. It could be, you know, it could be like, you know, quality dashboards. It could be almost anything where they kind of pick up their work, take it out of email, and do it in a more collaborative fashion. And once they do it once, it's like the light bulb goes on and they're like, this is so much easier. You know, I'm not chasing emails around. I'm not having to repeat things 500 times or whatever. And now all of a sudden my work got easier. I have better connection with the people I'm working with. And that's when the light bulb comes on. The other thing I want to mention is Amy mentioned this briefly, but, you know, Jive has their annual conference every year. This year it's May 1st through 3rd in Las Vegas. And we do on the first day of the conference, we do a day specifically for all our healthcare clients. And it's all, the whole day is basically client presentation. So all we do is provide the facility, and it's a great way to kind of hear how different people are using the software, and then a great way for them to kind of learn from each other. So as they're trying to figure out how to expand the use, that really helps when you can hear it from a peer.
Yeah.
Thank you both for diving into that question. And it looks like we have time for one more question today. Did you pilot the new communities first, or did you push out to all audiences at the same time?
So yeah, I would say that each one of these communities was kind of a pilot unto itself. You know, it is. I mean, all of them are such a new way for people to get into working in a different way. We piloted definitely with smaller populations, but you know, as we've expanded, they really, I guess they've started as a pilot, but they've really expanded to a much broader base as time goes on, just from word of mouth. People hear about it, they see it on Jive, they get involved, they join, and so they expand kind of organically and naturally, as Bill talked about, kind of that organic growth. We see that happening. Any other questions?
That is all. Just really great, fantastic questions from the audience and informative answers from both Amy and Bill. And that is all the time we have for today. I want to thank Bill and Amy for their excellent presentation, and to our audience for participating today. Enjoy the rest of your day, and we look forward to having you join us for future webinars.